Remove the pocket mask from its case and ensure it is clean and sterile. Ask bystanders to move away and clear the airway. Tilt the head back and lift the chin to open the airway. Place the mask on the casualty's face with the narrow end over the nose and the wider end over the mouth. Use your fingers to create a seal between the mask and the casualty's face, ensuring that the mask is pressed firmly against the skin to prevent air leakage. Deliver 2 rescue breaths by blowing into the one-way valve on the mask. Continue with chest compressions while maintaining the head tilt and jaw grip to keep the airway open. After every 30 compressions, stop and deliver 2 rescue breaths using the pocket mask, then resume compressions. Remember, if you are not trained to use a pocket mask, do not attempt to use one during a CPR emergency. Stick to the basic steps of CPR until medical professionals arrive on the scene.